If I have a black female surgeon, my first assumption will be this person had to meet lower standards because the school or the certifying board was so anxious to say we have a black female.
You know what, Tucker? If I had a black female surgeon walk into my room, I know that I am in damn good hands. And do you want to know why I say that? It's because she's had to work 10 times harder to get to where she is because of people just like you. Throughout her entire educational journey and career, she's had to prove herself over and over again from people just like you that judge people that look just like her. As a board certified neurosurgeon, I have passed every single board qualifying examination to get to where I am, and so has she. So pull up a seat, Tucker, and let me educate you about DEI. And don't worry, we know that you didn't save a seat for us, so we brought our own. You see, DEI is not about lowering standards. Let me teach you a little bit about what you in your privileged platform do not understand. To be a board certified surgeon, you have to pass every single examination that every other surgeon has to. So it's not about lowering standard, it's about breaking down barriers. And what does that do for people like you? It makes our healthcare a much better system. Sure, I can quote the studies where female surgeons have better outcomes and that female patients are less likely to die under the care of a female surgeon. But that's not only what this is about. It improves cultural competency in our healthcare system. It enhances patient trust and communication. Historical biases and systemic inequalities lead to disparities in access. DEI can improve that. And I know that narrow mind of yours probably doesn't understand what I'm saying, so let me make it a little bit easier for you to understand. Patients are more likely to trust the advice of their doctor and follow that advice if, shocker, they look like them and they can relate to them. I know that's hard for you to understand because you can't relate. A diverse team on your side is going to bring different perspectives and better decision making and innovation in complex fields like surgery. These women have seen different things than you have, Tucker, and will bring varying opinions and innovation to the field. And that's going to mean things like surgery are better for you. More workforce representation and inclusion is going to make it a better place to work. So that's going to reduce things like burnout. That's because the field has been highly dominated by people that look just like you. And you know what? Quite frankly, some people get burnt out by that. The goal of medicine is to provide equitable care. And whether or not that small little brain of you chooses to understand this, ignoring DEI is going to perpetuate the medical education in the exact same way that it always has been. So no, it's not about lowering standards. That's how you got where you are.